डायबिटीज रिवर्सल सेशन को आपण को वेलकम बिकॉज आज सेशंस रे आमे जानिबा कौन कौन जानिबा ता ऊपर टिके नोट कर दियंतु प्रथम जिंस जानिबा व्हाट इज डायबिटीज डायबिटीज कौन डायबिटीज रिवर्सल रो मीनिंग कौन सेकंड आमे जानिबा कि काहे कि डायबिटीज रिवर्सल रो जरूरी अटे एवं तापरे सम सक्सेस स्टोरी देखिबा एक्चुअली कौन सतरी डायबिटीज रे लोक भल ही पारछंती डायबिटीज रे मेडिसिन फ्री ही पारछंती डायबिटीज रे इंसुलिन फ्री ही पारछंती एवं ता संगे आमे डिस्कस करिबा कि मिथ्स कौन अछि इन डायबिटीज ओके एंड लास्ट को डिस्कस करिबा को प्रोटोकॉल्स थ्रू आमे रिवर्स करि परिबा तार बेसिक 1 to 2 प्रोटोकॉल आमे स्टार्ट करिबा काली इन द सेंस कि डे 2 रे आमे डाइट विषय डिस्कशन करिबा डाइट्स इन डायबिटीज कौन खाइबानी ऑल दिस थिंग एंड डे 3 रे आमे डिस्कस करिबा नॉट ओनली डाइट आउ कौन कौन प्रोटोकॉल अच्छी ताकू नहीं कि हमें डायबिटीज को रिवर्स करि परिबा ओके सो इन टोटल हमर प्रोग्राम्स बेसिक दिस इज द बेसिक डायबिटीज रिवर्सल प्रोग्राम 3 days program okay in 3 days all this thing will cover okay so welcome to day 1 and please ready with your notes pen and paper ଆପଣ ନୋଟ୍ସ ଯଦି ରଖିବେନି କିଛି ଲେଖିବେନି କିଛି ଫାଇଦା ନାହିଁ ଓକେ ଯଦି ଆପଣ କିଛି ବୁଝିବାକୁ ଚେଷ୍ଟା କରିବେ ଆମେ କଣ ପାଇଁ ଏ ପ୍ରୋଗ୍ରାମ୍ସ କରୁଛି ମୁଁ ଆଉଥରେ କହିଦଉଛି ଆପଣଙ୍କୁ when you go to any hospitals any doctors they will give you time for how many minutes 5 minutes 10 minutes maximum maximum half an hour right and ସେଠି କଣ ହଉଛି ଆପଣଙ୍କୁ ଡାଏଟ୍ସ ଆଣ୍ଡ ଲାଇଫଷ୍ଟାଇଲ ବିଷୟରେ କିଛି ଏଜୁକେସନ ମିଳୁନି ଯୋଉଥିପାଇଁ କି କଣ ହଉଛି your medicines numbers 1 2 3 4 5 all these medications will go on and people are no knowledge on this side effect of these medicines and যদি long term maybe কোন অসুবিধা হবো even I have seen a lot of people taking insulin also मतलब 1 2 3 so many doses insulin ନେଲା ପରେ ତାଙ୍କର ବଡି କେତେ ଟକ୍ସିକ ହେଇଯାଏ ଓଭରୱେଟ ହେଇଯାଆନ୍ତି ତାଙ୍କର ପେଟ ବଢିଯାଏ ତାଙ୍କର ବଡିରେ ଫ୍ୟାଟ ଡିପୋଜିଟ ହେଇଯାଏ because they have no knowledge on that କି ସେମାନେ ଭାବୁଥିବେ ମୋର ତ ସୁଗର ନର୍ମାଲ ଅଛି even after taking the insulin but they don't know the side effect of insulin also okay so all this thing upare ame charcha kariba last ko discussion kariba what are the side effect of that medications also and how to reverse that okay so be ready with that and ready with your notes pen and paper okay so video last ko mu gote task debi apanku and you need to fill up that task fill up kala pore day 1 task habo day 1 pore day 2 task habo day 2 pore day 3 okay and last को in the day 3 we will have a question answer session ଆପଣଙ୍କର ଗୋଟେ ବେସିକ କ୍ୱେଶ୍ଚନ ଆମେ ଦେଇଥାଉ those who pass that test ଆମେ ତାଙ୍କୁ ଆମର advance program କୁ ବି ନେଇଥାଉ ଯେମିତି କି 1 year program ଅଛି କିମ୍ବା ଆମର camp programs and all these things okay so listen all these days very careful day 1 day 2 day 3 ଆପଣ ଯଦି ଅଲଗା କିଛି କାମରେ ଅଛନ୍ତି ଆପଣ you can stop that work and we focus on this 3 days meeting programs okay chalo thank you so this is the day 1 slides just more present kurchi apanku you can see that thing yeah upon proof of reversal already I share in that group so many people those who have reversed the diabetes all these things have a lot of impact so I hope this slide is visible to all of you okay yeah chalo so this is the day 1 of this 3 days basic diabetes reversal challenge ଆମେ ଆଗରୁ ୟାକୁ 5 days କରୁଥିଲୁ but we make it 3 days because of time constraint and all these things so yes these are basic rules and regulations it's a very actionable workshop ଆପଣଙ୍କୁ ଯୋଉ ଟାସ୍କ ଦିଆହବ ଆପଣଙ୍କୁ ଯୋଉ you know ଜିନିଷ କୁହାହବ ଆପଣ ଟିକେ ଫଲୋ ଯଦି କରିବେ you can get the result very soon no doubt of that okay chalo then second thing is that be ready with your notes pen and paper yes this is a very important thing notes pen and paper is very important thing otherwise you cannot understand all this thing okay so be ready with your notes pen and paper okay if any questions arise you can ask in the comment box during the live class also or at the end of the meeting you can clear that doubt okay so last good task bhi diya you need to clear that task also This is my basic qualifications before going to this kind of meetings because people cannot believe. People are now following, any videos in the YouTube. So many videos in the YouTube. Okay, and they are following some abnormal things also, and they are believing that this is very good for me. And this is the problem also now. ସେଥିପାଇଁ ଆପଣଙ୍କ ପାଇଁ ଏଇ programs first time in the Odisha we have bring a lot of success. Now ଏବେ କ'ଣ ହଉଛି we have a camp program also ଯୋଉଠି କି patient ଆସିକି we can stop their insulin within 1 to 2 days also, right? Lot of success stories you can see, right? So this is my basic qualification. ମୋର MBBS ଭୀମସାର ମେଡିକାଲ କଲେଜ ବୁର୍ଲାରୁ ହେଇଥିଲା। ମୋର post graduation is from the MKCG Medical College Berhampur. Now working as assistant professor in SRM Medical College also. And after researching a lot of books on natural healing systems and this role of diets and how to reverse that, role of, I have so many mentors actually, on this particular things. So ତାଙ୍କଠୁ ବହୁତ କିଛି ଶିଖିଛି and ଶିଖିଲା ପରେ ଏଇ ଜିନିଷକୁ ମୁଁ apply କରୁଛି ଯୋଉଟା କି ଆପଣଙ୍କୁ ଟିକେ ନୂଆ ଲାଗିପାରେ but this is the truth. And author of this course also, I'm author of this diabetes reversal mastery course, and we have a lot of participant in that course. And if you want, you can also join at the end also. Okay, but this is a basic 3 days program. You should not miss this. Okay, chalo. So what is the meaning of reversal? Reversal or basic meaning ଆପଣଙ୍କୁ କହିଦଉଛି, going in opposite direction. Okay, suppose ଆପଣ ଗାଡି ଚଲାଉଛନ୍ତି, you go to the hill station, right? Off and off. You need to reverse it, reverse gear of the gadi, right? So you need to go to back. Okay, so suppose if you are taking insulin medicines, the amount of and doses of that going off and off gradually coming ଯିବ. Okay, and ଆପଣଙ୍କ ଦେଖିବେ ସୁଗର ଲେଭେଲ ବି ନର୍ମାଲ ହେଇଯିବ, କିଛି ଦିନ ପରେ ମେଡିସିନ୍ସ ବି ଷ୍ଟପ୍ ହେଇଯିବ, ଇନସୁଲିନ ବି ଷ୍ଟପ୍ ହେଇଯିବ, and you normalize your blood glucose, blood pressure readings also. You're free from the any complications of diabetes. Remember, diabetes, write in your notes also. Diabetes is a silent killer. Diabetes is a silent killer. Just write in your notes. Why I am called it silent killer? ଆପଣଙ୍କର ଯୋଉ ବ୍ଲଡ ଗ୍ଲୁକୋଜ ସ୍ପାଇକ୍ ହେଇକି ରହୁଛି, ଇନସୁଲିନ ରେଜିଷ୍ଟାନ୍ସ ରହୁଛି, ଆପଣଙ୍କର ଡିଫରେଣ୍ଟ ଭିସରାଲ ଅର୍ଗାନ୍ସ ରେ ଫ୍ୟାଟ କୁ ଡିପୋଜିଟ କରିଥାଏ. ୟେସ୍, ଆଇ ହାଭ୍ ସିନ୍ ଏ ଲଟ୍ ଅଫ୍ କେସେସ୍. ଫ୍ୟାଟ କୁ ଡିପୋଜିଟ କରିଥାଏ. Okay, suppose I am giving one example. You are taking insulin, right? Those who are taking insulin, just type I in the chat box. Those who are taking insulin, just type I in the chat box. Okay, I want to check how many of people are taking that. Okay, so what it do? It first take out the glucose from your blood. Okay, ଆପଣଙ୍କ blood ରୁ ସିନା glucose କମିଯିବ, but that will get deposited and in different parts of the body when insulin resistance develop. And sometimes ଆମେ ଦେଖିଛୁ ତାଙ୍କର ଓଜନ ବଢି ବଢି ଯିବ, sometimes ଆମେ ଦେଖିଛୁ ତାଙ୍କର ପେଟ ବଢି ବଢି ଯିବ, ମୁହଁ ଫୁଲିଯିବ, ଗୋଡ ଫୁଲିଯିବ, fatty liver ହେବାର ବେଶୀ chances ଥାଏ like that. So in reversal, what we do, we gradually taper that insulin doses, medicines doses as per their as per their reports also. Okay, so they free from the diabetes complications also. जो complication तांको हेबार थिला ସେମାନେ free ହେଇପାରିବେ. They will also weight loss ହେଇଯିବ ତାଙ୍କର. They will also look younger and become fit. Okay, those who uh, those who get understand this reversal, just type RR in the chat box. Just type RRR, reversal in the chat box. Okay, it's also called remission nowadays. Reversal means complete extermination of the disease, cure. But remission means partial. Partial reversal is called remission. Yes. It is Sri Mohanty, madam. Thank you so much, Nima. Yeah. So thanks a lot, those who are typing. Because reversal meaning upon bujile next step ko upon jaipari, what to do for that. Okay. Let me show you some of the things, what is called some examples, right? See, this is the success story. His name is Mr. Bhavani Prasad Patnaik. He joined my program and his weight was 86 kg, but now 70 kilo. He was taking 8 tablet, and now no tablet he was taking. No any tablet. Yes. Within after this is the result after 3 months. Okay. You can see his abdomen size, but now the abdomen size is reduced. Okay. Yes. You can see swelling of the face, but now face is not swelled. You can see the double chin feature, just double chin feature, mota hijaye, mota facial look. It will change to like this transformation. You can see HbA1c that is 13%. This is the gold standard test को आ जाता है HbA1c को. And it is 6% now. ppbs 210, but now 120 now. Okay. You can see the fasting blood sugar 280, but now it is 99 without medicines. Before he was taking 8 medication. 8টা medicine ଖାଉଥିଲେ. Along with he was also blood pressure. But people cannot believe that blood pressure also reverse. Okay. But in my program, hundreds of patients already also stopped their medication with my guidance, proper guidance, right? So these are some not only one story. I'll see you a lot of success story. Okay? Not only one story, When you go to yeah, so many people are typing reversal RRR. This is the meaning of actual reversal, okay, friends? Yeah, and this is possible because of their understanding. ମୁଁ ଯାହା କହୁଛି ତମକୁ ସେମାନେ ବୁଝୁଛନ୍ତି ତାଙ୍କ notes ଆପଣ ଦେଖିବେ they will make notes like my medical students. I teach in a medical college to my medical students, and they all make their notes very clear. Okay. I make all the points very concise. Meaning of reversal, all you type RRR, thanks a lot. Like this. Then some examples show କରିବେ ଆପଣଙ୍କୁ. Then some proofs, some beliefs ଆସିବ ଆପଣଙ୍କର. Then ଆପଣ step by step plan କରିବା. Okay. So when you go to my YouTube channel, you so many lot of other videos also. When you go to my YouTube channel, not only one video, you can see a lot of video. This is my YouTube channel, right? Yeah. You can go to my YouTube channel, just type Dr. Madhav in the YouTube channel. I'll share you the link also. Okay. I'll share you the link also. But when you just go to YouTube channel and type my name also, just we type Dr. Madhav, THAB and NAYAK diabetes, DIABETES. Just you type like this also. You'll get a lot of videos of mine. See, this is a live video going on, and you can see in the YouTube also. Okay. Yeah, and so many news channel come. This is the Argus news channel, Argus News, and so many other news channel. You can see this video. This is one of my programs video where I taking my classes to my patients. This is practical classes. 42,000 view of this video. So many videos. This is my direct protocols video. My plant proteins and animal everything. I have explained very clear. People are asking so many the videos of your life, how to start all these things. So these are all these things. This is my camp programs details also you can see. So when you go to my channel, you click that channel. Okay. When you click that channel, if you want, ଆପଣ ଯଦି ଚାହୁଁଛନ୍ତି members ହେବା ପାଇଁ, ଆପଣ join that and you can also be a member of our channels so that you can watch others video also. That means someone unlisted video ଯୋଉମାନେ members ହୁଅନ୍ତି ତାଙ୍କ membership ମିଳିଯାଏ ଏଥିରୁ join କରିପାରିବେ ଆପଣ ୟାକୁ ନେଇକି ବି not an issue, but you can go to other video also. You can see the video section. Okay, so how the people have reversed their diabetes, how they are a success story. So many success story in my programs. They have come, they have joined and see their result. I have give all these things practical session I'll take. Okay, that's why in my program, you cannot believe in this thing indirectly. That's why I show all these proofs to you, how they have reversed and all these things. So you can also see this thing. Just type in the YouTube Dr. Madhav Naik diabetes, and you can also see a lot of video. Okay, you can see, yeah, it is N actually, but it will guide you. Okay, diabetes. Yeah. So when you see this thing, you can know it. Yes, this is possible. And how to possible? This is a step-by-step guidance, right? I'll give this guidance to all of you, and you can keep a success story of more than 500 patients in my YouTube channel also. Okay, so this is for your belief purpose. I am showing it to you. Okay. Next, I jump to my program. Okay. So let us jump to what to do for next. Okay. So that's why I do step by step things. So many patient, this is the one of patient Guru Prasad Dura. He was 97 kilo, but now 82 kilo, not 92. He was also taking around 8 medicines. He was on insulin out 10 unit, but now not taking any insulin. Okay. So however, man, a lot of people of this transformation you can see, not only on one patient. I am showing all these reports before, afters, and all these things. So, are you ready to check this challenge? Just type yes in the chat box. This is challenge for you. Challenge in the sense ki you can able to tell your what you can able to tell your friends, relatives, colleagues. I can also able to reverse my diabetes. So if you're ready, just ready in the chat box so that we can start the class session very soon. Okay, what is diabetes, what are the types of diabetes, and all these things. Because basic ଆପଣଙ୍କୁ ବୁଝିବାର ଅଛି କୋଉ type reverse ହେଇପାରିବ କୋଉ type reverse ହେଇପାରିବନି everything I'll clear. Now just type is my slide is visible? Yes or no? Is my slide is visible? Yes or no? Yes. Chalo. Very good. Visible. Okay, those are ready. Just thank you so much. It is Srimanti Bipin Pati sir. Ready? Very good. Chalo. Without any delay, start noting down the points जोटा ମୁଁ କହୁଛି ଆପଣଙ୍କୁ because ଆପଣ ଟିକେ basic ବୁଝିବା କୋଉ diabetes reverse ହେଇପାରିବ କୋଉଟା ହେଇପାରିବନି everything I'll tell you in my program. Okay. Very good. Chalo. This is challenge for you. Thanks for typing yes. And this purpose is to very simple because you have no time now for your health. ସେଥିପାଇଁ ଆମେ କଣ କରୁଛୁ ଆମର ସିମ୍ପଲ ୱେରେ ଦିସ୍ ମେଡିକାଲ ସାଇନ୍ସକୁ ଆମେ ଆପଣଙ୍କ ପାଖକୁ ପହଞ୍ଚାଇବାକୁ ଚେଷ୍ଟା କରୁଛୁ to reverse this kind of chronic disease like diabetes, blood pressure, gastric problem, obesity, thyroid problem, Alzheimer's disease, high cholesterol, high triglyceride, all this kind of lifestyle disease, it's because of sugar. Yeah, it's because of sugar, it's because of diabetes. So this is what my purpose to empower you and those who ready for empower of all these things to grasp this knowledge because जब तक ଆପଣ ଏଇ knowledge को grasp କରିବେନି only medicines ପଛରେ ଧାଇବେ this meeting is not for that people. Okay, my mission is this thing to empower that people ଯୋଉମାନେ এই ବିଷୟରେ knowledge କିଛି ରଖି ନାହାନ୍ତି and with this empowerment technique I got that thousands of results what I've shown just before So in that thing, who can attend this program? Before it was 5 days actually, but now it is 3 days. Who can attend this program and pre-diabetes, diabetes patient, those who are taking medicines or insulin, PCOD, blood pressure, all these things patient. ठीक ଅଛି? So I'm just going to topic proper key what is diabetes and where we need to there are some lies also, but we discuss the lies later. So yes, come now. So these are some myths versus facts in diabetes. Then let's type in the chat box. The 5 biggest lies on type 2 diabetes. Okay, let's type in your notes. Okay, because lies is very important. ଆପଣଙ୍କ ମାଇଣ୍ଡରେ ସେଇ କନଫ୍ୟୁଜନ ଏବେ ବି ଅଛି lies. If you not clear that lies, that causes problem. You cannot reverse diabetes. Okay, so just type the 5 biggest lies on type 2 diabetes. Okay, so first lies, once you have diabetes, you must need to take medicines for lifetime. Okay, this is the lies. But I'll just show you that patient, ଯୋଉମାନେ already reverse କରିସାରିଛନ୍ତି, ଯୋଉମାନେ so many patients have reversed it. So this is the lies. This is the truth is you can also have a medicines free life. You can also have a insulin free life. Yes. ଯେମିତି previous patient ମାନଙ୍କର ଦେଖେଇଲି ଆପଣଙ୍କୁ. Okay. Second lies, ବହୁତ ଲୋକ ଆପଣ ଜାଣିଥିବେ. Once you have diabetes, you cannot eat coconut, you cannot eat ghee, mutton, and all these things. ମାଛ ମାଂସ ନା କିଛି ଖାଇବେନି ବୋଲି ମନା କରାଯାଏ ଆପଣଙ୍କୁ. It's a wrong science, actually, old science. But now, new science already evinced, and that tell you can also able to tell that eat that. Okay. So how to take that and all these things ମୁଁ ସେ ବିଷୟରେ ଆପଣଙ୍କୁ ଜଣାଇବି. Okay. Lies number 3. If your parents are diabetic, you always become a diabetic. ଏମିତି କୁହାହେଇଥିବ. parents are diabetic jodi hele apanku sobule diabetes hobole kuha heithibo. But this is also not true because in reality you can have a very diabetes free life even your parents have diabetes because the genetic role is only 15 to 20%. Rest other percentage is your lifestyle or your diet, environmental factors. Okay. You must follow a very strict diet plan. But remember, my friends, it's not very strict, but understanding the diet, understanding the EGL principle, estimated glycemic load kono, କୋଉ diet ନେବେ କେମିତି diet ର estimated glycemic load କମ କରିବେ, okay, which is good for you. All this knowledge is very important. Okay. So that's why it is called a program where we give the guidance. It's a coaching program. We will coach you. Okay. And the truth is that you can have a very flexible and variety of foods to eat. Just meeting start କରିବା ଆଗରୁ ଯେମିତି ଆମର ନିର୍ଭୟ ବାବୁ ଆମର 1 year program join କରିଛନ୍ତି ସେ ଯେମିତି ଆପଣଙ୍କୁ ଜଣେଇଲେ, you can also able to stop that. Yeah. So type 2 diabetes can be never be fast. What is the meaning of that? Intermittent fasting, right? But remember, my friends, in reality, the intermittent fasting shows a very miraculous results in type 2 diabetes. And that's what I guide you. Okay. But this is the problem statement now. So many people in India now, more than 101 million people have diabetes. 101 million people have diabetes. And the number is going on increasing day by day. Why? Because people have no knowledge on reversal, right? Because they are not reversing their diabetes. That's why the medicines number, dosing, and all these things gradually increasing day by day. Okay, friends. So ଆମେ ସେଥିପାଇଁ ଆପଣଙ୍କୁ reversal knowledge କୁ ପ୍ରଥମେ focus କରିଥାଉ so that ଆପଣ once you have got this knowledge, then you can also clear your doubt also, right? Okay. And this is the problem, This is the ICMR studies, Indian Council of Medical Research. More than 101 million people have diabetes by India today. So କହିବାର ମାନେ ହଉଛି କଣ କି because ଆମେ once ରୋଗ detect ହେଲା ପରେ ଆମେ ତାକୁ reverse କରୁନୁ, ଆମେ ତାକୁ ବଢେଇ ବଢେଇ ଚାଲିଛୁ 1 2 3 4 like that because we have no knowledge on this thing, and this is the problem now. Okay. So but remember, 1 in 11 diabetes, 11 adults has diabetes, adult onset diabetes, 1 in 11 ମାନେ ଦେଖନ୍ତୁ 11 ଜଣରୁ ଜଣକୁ diabetes ହେବେ. So problem is that people have no knowledge on this reversal. That's why the number is increasing. This is the prevalence of diabetes. ଆପଣ ଦେଖନ୍ତୁ କେମିତି ବଢି ବଢି ଚାଲିଛି world wide prevalence. Okay. 2005 ରେ କେତେ କମ ଥିଲା, 2040 expected ଦେଖନ୍ତୁ ଆପଣ 642. Okay. Millions expect କରାହଉଛି. So many number. So ପଳେଇବା basic knowledge କୁ what is diabetes ଆପଣ ସମସ୍ତେ ଜାଣିଛନ୍ତି. ବ୍ଲଡ ସୁଗର ବଢିବାଟାକୁ ଡାଇବେଟିସ୍ କୁହାଯାଏ, ବଟ୍ ମନେ ରଖନ୍ତୁ ଯୋଉ ବ୍ଲଡ ସୁଗର ବଢୁଛି କଣ ପାଇଁ ବଢୁଛି, ଆଇଦର ଆପଣଙ୍କର ଇନସୁଲିନ ହର୍ମୋନ ପ୍ରଡକ୍ସନ କମି ଯାଇଛି ଅର୍ ଆପଣଙ୍କ ଶରୀରରେ ଇନସୁଲିନ ହର୍ମୋନ କାମ କରୁନାହିଁ. Basing upon these two things, we guide you that which kind of diabetes you have. Okay. Basing upon these two things, we guide you which kind of diabetes you have. You have either type 1 or you have type 2 like that. Okay. So ଆମର ମେନ୍ ପର୍ପୋଜ ଥାଏ କଣ କି ଆପଣଙ୍କୁ ବେସିକ ନଲେଜ ଦେଇଦେଲା ପରେ ଆମେ ତାପରେ ଗାଇଡେନ୍ସ ଦେଇଥାଉ ଆପଣଙ୍କୁ. So listen to this basic knowledge, then we also guide you properly also for that. Okay. Yes. So diabetes reversal, yes, diabetes ର actual meaning ହଉଛି କି blood sugar ଆପଣଙ୍କ blood level ରେ normal glucose ଠୁ ବଢିଯିବ. And suppose I just giving you example, fasting blood sugar ଆପଣଙ୍କର ଯଦି more than 126 ଲେଖିକି ରଖନ୍ତୁ. Just write in your notes. If the fasting blood sugar, खाली पेटर sugar, more than 126 is called diabetes. 126 is called diabetes. Second, if your PP blood sugar, खाई सारलार blood sugar, after 2 hours of food, if it is more than 200 is called diabetes. Okay. Or RBS, random blood sugar, which is more than 200 is called diabetes. your HbA1c, that's called glycosylated hemoglobin, HbA1c level, if it is more than HbA1c level is more than 6.5, 6.5 is called diabetes. Write the points. 3 points ମୁଁ କହିଲି ଏବେ ଆପଣଙ୍କୁ କଣ କଣ କହିଲି? Yeah, very good. First point, fasting blood sugar more than 126 is called diabetes. Very good. Yes. Second, your red ଖାଇ ସାରିଲା ପରେ sugar, random blood sugar ଯଦି more than 200 is called diabetes. Yes. Then third point ମୁଁ ଆପଣଙ୍କୁ ଆଉ ଗୋଟେ କହିଲି, HbA1c, that is called glycosylated hemoglobin. Okay, glycosylated hemoglobin. Yes, very good. If it is more than what? 6.5 is called diabetes. Very good. Okay. Yes. Then ଆମେ diabetes को डिटेक्ट करिया ପାଇଁ ଆଉ କିଛି ଟେଷ୍ଟ ଅଛି କି? ଲୋକ କଣ କରନ୍ତି ସେଇ ଟେଷ୍ଟିଂ କିଛି କରିନଥାନ୍ତି, ରାଇଟ୍? ମୁଁ ସେଇ ବିଷୟରେ ବି ଆପଣଙ୍କୁ ଟିକେ ଜଣେଇଦେବି. What test should be done and what test should not be done? Because ଏବେ ବହୁତ ପ୍ରୋଟୋକଲ ଚେଞ୍ଜ ହେଇଗଲାଣି. ଆପଣ କେବେ ପ୍ରୋଫାଇଲ ଟେଷ୍ଟ କରୁନଥିଲେ, we have so many profile test on that. ପ୍ରୋଫାଇଲ ଟେଷ୍ଟର ମିନିଂ କଣ ଆମେ କହିଥାଉ, ଯୋଉ ଟେଷ୍ଟରେ ଆମେ ଜାଣିଦେବା କି ଆପଣଙ୍କର ଆଉ କଣ କଣ ପ୍ରୋବ୍ଲେମ୍ସ ଅଛି. Okay, so just I'll show that some testings also ମୁଁ ଆପଣଙ୍କୁ ଦେଖେଇଦେବି. ଆପଣ କେବେ ଫାଷ୍ଟିଂ ଇନସୁଲିନ ବିଷୟରେ ଜାଣିନାହାନ୍ତି, ଆପଣ ଇନସୁଲିନ ରେଜିଷ୍ଟାନ୍ସ କଣ ଜାଣିନାହାନ୍ତି, ସେ ବିଷୟରେ ବି ଆମେ ଟିକେ ଚର୍ଚ୍ଚା କରିବା ଆମର ପ୍ରୋଗ୍ରାମ୍ସ ଡିଟେଲ୍ସରେ. ଆଣ୍ଡ ବିକଜ जब तक बेसिक नॉलेज ना हो अपन जानी पारिबेनी. So let me show that things to you. Okay, which yes. Okay, चलो. So diabetes कौन हुए अपन इधर only medicines ऊपर depend करती, your the medicines number increasing day by day, and that causes problem. And the practice guidelines are all focused on this drug management, not on reducing the medications. No any practicing guidelines now for to taper your medicines, but this is the problem now. That's why ଆପଣଙ୍କ medicines tapering କେବେ ହଉନି. Okay, so tapering को हमें focus करता हूँ in my programs. Just go to basic anatomy. कि yes, this is the your liver. Okay, this is your liver. एटा होचे आपनकर liver. This is the abdomen, and this part is called pancreas. You can see that. Okay, yellow part. Pancreas is in Odia it is called अग्नाशय. ओडिया रे कौन कुआ जाए को? Very good. अग्नाशय कुआ जाए. Okay, it's called अग्नाशय. Okay, अग्नाशय. In Odia it is called अग्नाशय. Okay, चलो. Very good. Very good. In Odia it is called अग्नाशय. Okay. So chalo, just a minute. I'll show you one thing. In Odia it is called अग्नाशय. Okay. So एथिरे कौन हुए insulin production ହେଇଥାଏ. एटा होची आपनकर different parts of the pancreas. You can see that things. Okay. And gradually कौन हुए तारो आम यदि histology नबा ना, basic anatomy, that content beta cell. Beta cell गोटे देखंतु आपनकर beta cell जोटु insulin production ହେଇଥାଏ. Yes. Remember my friend, this is a beta cell and where the insulin is produced. Insulin hormone beta cell रू produce ହେଇଥାଏ, मन रखंतु. Yeah. ଏବଂ जो insulin hormone production ହେଇଥାଏ, that's a very important hormones to know and to your particularly कौन ଆପଣଙ୍କର conditions ଜାଣିବା ପାଇଁ ଆପଣଙ୍କର particularly yes, just a minute. Okay, so केते insulin production होची, insulin production रो quantity केते, जदि आमे देखिथाउ बहुत केस रे टाइप 2 डायबिटीज केस रे इंसुलिन प्रोडक्शन सफिशिएंट होथाय, किंतु बीटा सेल्स काम करन थाय. से केस रे बीटा सेल माने सेंसिटिविटी कमी जाय थाय. से केस रे देखो रेजिस्टेंस बोली कुआ जाय. ता विषय गोटे रिपोर्ट मु आपन को देखौची, जस्ट हाउ टू नो दैट. ओके, जस्ट आई एम शोइंग यू वन रिपोर्ट्स. ओके, को टेस्ट आमे करतो से विषय जनकर रिपोर्ट आपन को देखौची. जस्ट आई एम शेयरिंग द रिपोर्ट्स. See, this is a one report, so where we advise our patient to show their HOMA IR test. Kehi କରନ୍ତିନି, but we practice to do in my programs. ଯୋଉଥିରେ ଆପଣଙ୍କ ବିଟା ସେଲ୍ କେତେ ପରସେଣ୍ଟ କାମ କରୁଛନ୍ତି. Anybody has tested that things? Just type in the chat box. ଯୋଉମାନେ ଟେଷ୍ଟିଂ କରୁଛନ୍ତି ବିଟା ସେଲ୍ କେତେ କାମ କରୁଛି. Nobody? Okay. ଚलो. Yeah. So এই যে ଯୋଉ ବୁଝେଇଲି ଆପଣଙ୍କୁ ଆପଣଙ୍କ ପାନକ୍ରିଆସ ଥାଏ ପାନକ୍ରିଆସରେ ଗୋଟେ ବିଟା ସେଲ୍ ଅଛି ବିଟା ସେଲ୍ ଯଦି ଠିକ ସେ କାମ କରୁନଥିବ ତାହେଲେ ବି ଡାଇବେଟିସ୍ ହେବ ଏବଂ ଆପଣଙ୍କ ଇନସୁଲିନ ଯଦି ବାହାରୁଛି ଏବଂ ଇନସୁଲିନ କାମ କରୁନି ତାହେଲେ ବି ଡାଇବେଟିସ୍ ହେବ ରାଇଟ ସି ପିପୁଲ ୟା ଭିତରେ ଡିଫରେନ୍ସ ଜାଣିପାରନ୍ତିନି ଜଷ୍ଟ ଲେଟ୍ ମି ଶୋ ୟୁ ୱାନ୍ ରିପୋର୍ଟ ଓକେ Okay, so I hope you can see this HOMA IR2 report. See, this is the report, HOMA IR2 କେମିତି ଏକ୍ସପ୍ଲେନ୍ କରାହେଇଛି ଦେଖନ୍ତୁ ଆପଣ ଦେଖନ୍ତୁ ଗୋଟେ ପେସେଣ୍ଟଙ୍କର ମୁଁ ରିପୋର୍ଟ ଆପଣଙ୍କୁ ଦେଖଉଛି you can just see this thing ଗ୍ଲୁକୋଜ ଦେଖନ୍ତୁ ଏଥିରେ କଣ ଗ୍ଲୁକୋଜ ଫାଷ୍ଟିଂ ଅଛି 127 ଇନସୁଲିନ ଫାଷ୍ଟିଂ ଅଛି 6.5 16.5 ବିଟା ସେଲ୍ ଫଙ୍କସନ୍ସ ଅଛି 82% that should be more than 100 ଆପଣ ଲେଖି ରଖନ୍ତୁ normal beta cell function should be more than 100%. Okay? But ତାଙ୍କ କେସରେ 82% ଅଛି ଦେଖନ୍ତୁ but insulin sensitivity 43%. Insulin sensitivity 43%. That should be more than 100%. So it is typical case of type 2 diabetes. ବୁଝିପାରିଲେ? Anybody had done this test? Just type I in the chat box. Anybody have done this test? Just type I in the chat box because I'll also advise how to do this test. Okay, ଆପଣ କେମିତି test କରିପାରିବେ? How to do this test? I also give you the number for that test. No need to worry. Okay? So because ଆମେ ପ୍ରଥମେ କିଛିଟା diagnostic value କୁ ଯାଇଥାଉ ତାଙ୍କର ଆପଣଙ୍କ actually medicine ନେଇ ନେଇ ଆପଣଙ୍କ ବିଟା ସେଲ୍ କାମ କରୁଛି ନା ନାହିଁ ଯଦି କାମ କରୁଛି କେତେ କାମ କରୁଛି and ତାର ହିସାବରେ ଆମେ ଆପଣଙ୍କର ଡାଏଟ ଟାକୁ modify କରିଥାଉ yes okay so these are basic things for your understanding okay then I jump to the yeah, how to do this test and all this thing I'll jump to that also what is the name of this test okay just a minute ମୁଁ ଆପଣଙ୍କୁ show କରିଦେବି not an issue for that and because basic testing ରେ ଜଣା ପଡିବ ଆପଣଙ୍କ ବିଟା ସେଲ୍ କେତେ କାମ କରୁଛି ବହୁତ ଲୋକ ଜାଣି ନଥାନ୍ତି ଏଇ ଟେଷ୍ଟ ବିଷୟରେ ସେଥିପାଇଁ ସେମାନେ ଲାଷ୍ଟ କୁ ପ୍ରୋବ୍ଲେମ ରେ ପଡିଯାଆନ୍ତି okay so that's why I try to show that test to with you also okay so not an issue this is called diref advanced package just write in your notes this is called diref advanced package test diref in the sense ki diabetes reversal package test yes okay. So let me show that image to you, okay? Yeah. Those who want this test, you can also do that. ଆପଣ ବି କରିପାରିବେ and different district ରେ ବି ଆମ ଏଇ center ଅଛି ଆପଣ ତାକୁ just ମୁଁ ଦେଖେଇ ଦଉଛି ଆପଣଙ୍କୁ you can also have this knowledge on this test. This is called direct advanced package test. Okay. Can you able to see my slide? Just type yes in the chat box. Can you able to see my slide? My screen? Okay. So this is called direct advanced package test. Yes, thank you. If you do it outside, it will cost around more than 8,000 cost ପଡିବ but ଏତେ costly ନୁହଁ ଏଇଟା ଆପଣ ଯଦି ଏଥିରେ କଣ ଆସୁଛି ଆପଣଙ୍କର ଭିଟାମିନ 102 ଟେଷ୍ଟ ଆସୁଛି ଭିଟାମିନ ପ୍ରୋଫାଇଲ ଭିଟାମିନ ଡି ଭିଟାମିନ B12 ଡାଇବେଟିସ୍ ପ୍ରୋଫାଇଲ ଆସିଥାଏ ଆପଣଙ୍କ ଥାଇରଏଡ ପ୍ରୋଫାଇଲ ଲିପିଡ ପ୍ରୋଫାଇଲ ଲିଭର ପ୍ରୋଫାଇଲ କିଡନୀ ପ୍ରୋଫାଇଲ and HOMA IR analysis all these things so ଆପଣ କହିବେ ସାର୍ ଏଇ ଟେଷ୍ଟ ସବୁ କରିବା କଣ ଦରକାର yes କଣ ପାଇଁ ଦେଖନ୍ତୁ ଡାଇବେଟିସ୍ ରେ ମଲ୍ଟିପଲ ଅର୍ଗାନ୍ସ ର କମ୍ପ୍ଲିକେସନ କୁ ଧରି ଦେଇଥାଏ ବେଳେ ବେଳେ so we need to rule out that also ଆପଣଙ୍କର kidney complications liver complications and nutritional deficiency all these things so you just note down this number okay ତଳେ ଗୋଟେ number ଦିଆହେଇଛି you can see this number yes or no ଦେଖନ୍ତୁ You can type the number 858. Just a minute. Number आपको show हो ना थी वो. I'll share this thing in the group. Yes. 858 590 8864. Okay. Just type the number, those who are watching my video. So that ଆପଣ ବି ସେ ନମ୍ବରକୁ କଲ୍ କରିକି ଆପଣଙ୍କ ଡିଷ୍ଟ୍ରିକ୍ଟରେ କୋଉଠି ହବ and all this thing ବିଷୟରେ ବୁଝିପାରିବେ. Okay. ଆଉ ଥରେ. Okay. Just typing the number 8590 8864. Okay, this is one number. Another number ମୁଁ ଆପଣଙ୍କୁ ଶୋ କରିଦଉଛି ମୋର ସ୍କ୍ରିନରେ ଯୋଉଟା କଲ୍ କରିକି ଆପଣ ବି ଏଇ ପ୍ରୋଫାଇଲ ଟେଷ୍ଟିଂ କରିପାରିବେ. Just a minute, I'll present that thing to you also because this test is very important to know the your progression status. Okay, ଆପଣଙ୍କ କୋଉ ଷ୍ଟେଜରେ ଅଛନ୍ତି ଡାଇବେଟିସର, ରିଭର୍ସାଲ ବିଟା ସେଲ୍ କେତେ କାମ କରୁଛି, ଏଇ ଯୋଉ ପାର୍ଟିକୁଲାର ବିଟା ସେଲ୍ ଅଛି ଏବଂ ଏ ବିଷୟରେ ମୁଁ ଆପଣଙ୍କୁ ଡିଟେଲ୍ସ ଜଣେଇଥାଏ because we all need to know this thing also, you know. The number is 78944. ଆଉ ଗୋଟେ number 78944 06450 06450 78944 06450. Just a minute, ମୁଁ ଆପଣଙ୍କୁ expand କରିଦଉଛି so that you can also see these things. Okay. Okay. Is this number visible? ଆପଣଙ୍କୁ number ଦେଖାଯାଉଛି କି ନାହିଁ? Yes or no? ଦେଖାଯାଉଛି ଯଦି yes ଲେଖନ୍ତୁ because save this number for the testing. ଆପଣ ଯଦି any place ରେ ଓଡ଼ିଶାର ଚାହୁଁଛନ୍ତି you can do this testing. Okay. ଦେଖାଯାଉଛି 78944 06450. Yeah. ଭୁବନେଶ୍ୱରରେ ବି ହଉଛି, ଭୁବନେଶ୍ୱରରେ ଆପଣ କଲ୍ କରିକି କରିପାରିବେ. ଓକେ. ଓକେ, ୟେସ୍ ଭିଜିବୁଲ ସୋ ଦ୍ୟାଟ୍ ଆପଣ କଣ ଆମେ କଣ ଜଣା ପଡିଥାଏ, ୟେସ୍ ଇଟ୍ ଇଜ ଟୋଲ ଫ୍ରି ନମ୍ବର ଅଲସୋ. ଆପଣ ଏଇ ନମ୍ବରକୁ ସେଭ୍ କରିଦିଅନ୍ତୁ. ଏଇ ନମ୍ବରରେ ବେଟର ଯଦି ସେଥିରେ କିଛି ପ୍ରୋବ୍ଲେମ ହେଲେ ଏଇ ନମ୍ବରରେ ଆପଣ କଲ୍ କଲେ ଇମିଡିଏଟ ରେସ୍ପନ୍ସ ପାଇପାରିବେ ଆପଣ. ଆପଣଙ୍କର ପ୍ରୋଫାଇଲ ଟେଷ୍ଟିଂକୁ ଦେଖିକି ଆମେ କଣ କରିଥାଉ, we progress according to the reversal as per your and diet according to that also. I mean diet को सही हिसाब से भी modify करता हूँ because everybody's body is not same, right? I'll show you another some reports also जोथिरे आपण देखिबे अन्य लोक मानकर केमती प्रोफाइल टेस्ट वेरी करता है because समस्तଙ୍କର report same नଥାଏ, right? And according to that we vary with our protocol and our program also. So basic program रे ଆମେ किछटा टेस्टिंग भी करता हूँ आपनकर प्रोफाइल टेस्टिंग. And according to test, ଆମେ ବେଳେ ବେଳେ CGM ବି some participant କୁ install କରିଥାଉ but CGM ସମସ୍ତଙ୍କୁ ଦରକାର ପଡେନି. CGM ମାନେ continuous glucose monitor ଗୋଟେ ଅଛି. Yes. No, issue not to all because some participant need that, some participant may not need that. Okay. So yes. I am following the DIP diet last 4 years, but my HbA1 6.3. What is DIP diet? Can you explain, Sasikant Panda, what is DIP diet? What is the full form of that? Is there any standard diet called DIP like that? Not like that, right? Okay. So many people are, false, they're following any false diet, they have no any scientific background. Okay. This is the problem. They cannot reverse their disease and finally they suffer with the problem. Okay. Yes. So that's why more. Okay. ଆପଣଙ୍କ ପାଇଁ personalized diet ହେବ. It is your diet, not any other's diet. Okay. It is your diet as per your reports. This is called personalized diet. ଆପଣ ଲେଖି ରଖନ୍ତୁ. Yeah, this is called personalized diet. ଆପଣଙ୍କ diet यस आपन माने आपन रिपोर्ट्स को नहीं कि जो डाइट आम तैयार कर एंड नो सच काइंड ऑफ डाइट्स लाइक व्हाट आई टेलिंग की DIP diet, VIP diet. What is that here? All nonsense diet. Okay, so all you need to follow the diet according to your profile. Okay, what we advise to our participant also, and in my programs because all you know need to know because ଆପଣଙ୍କର ଯଦି ବିଟା ସେଲ୍ କାମ କରୁନଥିବ କୋଉ ଡାଏଟ୍ ଆପଣଙ୍କୁ ସେଇ ବିଟା ସେଲ୍ କୁ କେମିତି କାମ କରିବ ସେଇ ଡାଏଟ୍ କୁ ଆମେ କହିବୁ ନା ଆପଣଙ୍କୁ ସୋ ଆମର ପର୍ପୋଜ ହିଁ ସେଟା ଥାଏ କି we advise you as per your basic reports. That's why we do some kind of testings also for that. And according to testings, we know co-condition re apanko pancreas achi and all these things, right? Yes. Just I'm showing some reports with you. Yes. Yeah. Suppose I just show ଗୋଟେ report ଆପଣଙ୍କୁ show କରୁଛି ୟାଙ୍କର ବିଟା ସେଲ୍ କେତେ କାମ କରୁଛି ଯୋଉମାନେ କରିଥିବେ ସେମାନେ ଜାଣିଦେବେ ଦେଖିବେ ଏଇ ଟେଷ୍ଟରେ ଆମେ ଦେଖିପାରିବା ଆପଣଙ୍କ ବିଟା ସେଲ୍ କେତେ କାମ କରୁଛି ଦେଖନ୍ତୁ ବିଟା ସେଲ୍ ଫଙ୍କସନ୍ସ 82% ମାନେ କଣ ଭଲ କାମ କରୁଛି ଚଳିବ ତାକୁ 100 ଉପରେ ଆମେ କ୍ରସ୍ କରିଦେବୁ ଆମର ପ୍ରୋଗ୍ରାମସରେ ୱିଦାଉଟ୍ ମେଡିକେସନ ଅଲସୋ ଇନସୁଲିନ ସେନ୍ସିଟିଭିଟି କେତେ ଅଛି ଦ୍ୟାଟ୍ ମିନ୍ସ ଦ ଅପୋଜିଟ୍ ଇଜ ରେଜିଷ୍ଟେନ୍ସ ୟାଙ୍କର 43% ଅଛି that should be more than 100% sensitivity, right? Yeah. So resistance ଅଛି ଏ case ରେ around 67% resistant ଅଛି ଏ case ରେ, right? So ଆମେ କହିବା ଏଟାକୁ insulin resistance diabetes or type 2 diabetes ବୋଲି କୁହାଯାଏ ଲୋକ ନିଜର type of diabetes ବିଷୟରେ ଜାଣିନଥାଏ ତାଙ୍କୁ right? So ଆମେ ତାଙ୍କୁ type of diabetes ବିଷୟରେ ଜଣେଇଥାଉ not only one test you can see other test also my friends ভিটামিন ডি লেভেল দেখନ୍ତୁ କେତେ ଲୋ ଅଛି ଏ ପେସେଣ୍ଟର ଭିଟାମିନ ଡି ଭିଟାମିନ B12 ଦେଖନ୍ତୁ 188 ଭେରି ଭେରି ଲୋ ଓକେ ଦିସ୍ ଦ ପ୍ରୋବ୍ଲେମ ଭିଟାମିନ B12 କମିଲେ so many complication will come ଭିଟାମିନ ଡି ଦେଖନ୍ତୁ only 24 it's very very low ଏଥିପାଇଁ ଆମେ କଣ କରିଥାଉ ତାଙ୍କର ଲେଭେଲକୁ ଦେଖିକି ଆମେ ଆମର ଡାଏଟକୁ ଚେଞ୍ଜ କରିଥାଉ ମାଇ ଫ୍ରେଣ୍ଡସ୍ ୟେସ୍ ୟା ସି ପେପ୍ଟାଇଡ୍ ଲେଭେଲ ମାନେ କଣ ଆପଣଙ୍କ ପାନକ୍ରିଆସ ସତରେ କଣ କାମ କରୁଛି ୟେସ୍ କେତେ କାମ କରୁଛି ଜାଣିବା ପାଇଁ ଓକେ so many HbA1c ବି ପଳେଇ ଆସିବ ସେଥିରେ OMAR ପଳେଇ ଆସିବ ଆପଣଙ୍କର microalbumin ପଳେଇ ଆସିବ lots of good things will find and according to that we'll prepare the diet if the vitamin D is low we'll prescribe a diet high in vitamin D okay এটা হচ্ছে এই importance of this testing my friend if you do the CBC test see your erythrocyte count is low or your hemoglobin is low PCV is low MCSC low then ଆମେ ଭାବିବୁ ଆପଣଙ୍କର ଆଇରନ୍ ଡେଫିସିଏନ୍ସି ଏନିମିଆ ତ ଆଇରନ୍ କୁ ଆମେ ଠିକ କରିବୁ ରାଇଟ୍ ଆପଣଙ୍କର ଯଦି ହାଇପୋଥାଇରଏଡିଜମ ଥିବ ସପୋଜ ଥାଇରଏଡ ପ୍ରୋବ୍ଲେମ ଥିବ ଆପଣଙ୍କର so according to that we'll try change the diet also ବୁଝିପାରିଲେ yeah so this is why my program is the best program okay because as this is a personalized program my friends I know personalized program in the sense D3 yes vitamin D3 ସେଥିରେ ପଳେଇ ଆସିବ yeah so that thing will come in that see HSCRP ପଳେଇ ଆସିବ ଆପଣ HSCRP ଯେ cardiovascular risk ଯୋଉମାନଙ୍କର HSCRP ବେଶୀ ଥାଏ ହାର୍ଟ ଡିଜିଜ ହେବାର ଫ୍ୟୁଚରରେ ଚାନ୍ସେସ୍ ଥାଏ ତାଙ୍କର ସୋ ଆମେ ତାକୁ ବି ଆମ ପ୍ରୋଗ୍ରାମରେ ଟେଷ୍ଟିଂ କରିଥାଉ ଆପଣଙ୍କର କମ୍ପ୍ଲିକେସନକୁ ଜାଣିବା ପାଇଁ କିଡନୀ କମ୍ପ୍ଲିକେସନ ଜାଣିବା ପାଇଁ ମାଇକ୍ରୋଆଲବୁମିନ ଟେଷ୍ଟ କରିଥାଉ ଓକେ ଆମେ ଆଉ ଗୋଟେ ଜିନିଷ ଆପଣଙ୍କର liver complication ଜାଣିବା ପାଇଁ LFT profile ପଳେଇ ଆସିବ liver profile test ପଳେଇ ଆସିବ so all these things see this is the liver profile test to know the globulin is 3.0 all these things globulin SGOT SGPT will come why we do this kind of test my friend ମୁଁ ବାରମ୍ବାର ଆପଣଙ୍କୁ କହୁଛି what we measure that will improve what we measure just write in your notes ଏମିତି ଗାଲରେ ହାତ ଦେଇକି ବସିଲେ କିଛି ହବନି ଜୟପ୍ରକାଶ ସାର୍ ଆପଣ ଲେଖନ୍ତୁ notes ବୁଝିପାରିଲେ କି ନାହିଁ just try write the notes in your notes what you measure that will improve okay so where I am telling these things to you just this is the number you can save also for the testing those who want testing they can save this number take a screenshot of this number also take a screenshot of this number and you ask for the direct advanced test also okay don't chalo so ଆମେ ଯୋଉଟା ଡିସ୍କସ କରୁଥିଲେ ବିଟା ସେଲ୍ ଆପଣଙ୍କ ପାନକ୍ରିଆସ କେତେ କାମ କରୁଛି ପରସେଣ୍ଟେଜ ଜାଣିବା ପାଇଁ and all these things so ବିଟା ସେଲ୍ ର କାମ କେତେ ଅଛି ଜାଣିବା ପାଇଁ ଟେଷ୍ଟ କରାଯାଏ ଓକେ ଚलो ଦେନ୍ ଆମେ ପଳେଇ ଯିବା ଆପଣଙ୍କର କିଛି pancreatitis ହେଇଛି କି and all this thing so ଏଟା ତ advance ଜିନିଷ but ଆପଣଙ୍କର how insulin act ବେଳେ ବେଳେ କେସରେ ଆମେ ଦେଖୁ ଟାଇପ 2 ଡାଇବେଟିସ୍ କେସରେ ଇନସୁଲିନ କାମ କରୁନଥାଏ ସୋ ଆପଣଙ୍କ ରେଜିଷ୍ଟାନ୍ସ ଅଛି କି ୟେସ୍ ଅର୍ नो ତ ରେଜିଷ୍ଟାନ୍ସ ମାନେ କଣ ସେନ୍ସିଟିଭିଟିର ଜଷ୍ଟ ଅପୋଜିଟ ୱାର୍ଡ ଓକେ ଯଦି ଆପଣଙ୍କ ରେଜିଷ୍ଟାନ୍ସ କେସ୍ ଥିବ ତାହେଲେ ସେନ୍ସିଟିଭିଟି କମି ଯାଇଥିବ ଆପଣଙ୍କ for test outside Odisha it is available. For test outside Odisha you can do in the thyrocare, no problem, madam. And we have a similar package in the thyrocare also. You can do that test in thyrocare also. I'll show that test package to you, no need to worry. If you want outside Odisha, you save this number. In thyrocare, anywhere outside Odisha in India, you can save this number. And this is the number for outside Odisha, madam. Yeah, you can save 9023 317 317. This is for outside Odisha or thyrocare browser ଆପଣ କରିପାରିବେ. You can save the number 9023 317 317. This is a test package in thyrocare also, but he'll give you 99 package test. You tell the direct advanced package. Okay, you tell the direct advanced package test. Just take a screenshot of this page. Okay, yeah, chalo. Then we jump to the this is the things. Types of diabetes ଆପଣ ସମସ୍ତେ ଜାଣିଛନ୍ତି. Types of diabetes type 1 is equal to particularly ଛୋଟ ପିଲାମାନଙ୍କୁ ଯୋଉଟା ହେଇଥାଏ ପତଲା ଦେଖିବାକୁ ବହୁତ ପତଲା ଦେଖାଯାଆନ୍ତି ଟାଇପ 2 ଡାଇବେଟିସ୍ ଯୋଉଟା ବଡ ଲୋକମାନଙ୍କୁ ହେଇଥାଏ ମୋଷ୍ଟଲି more than 70% କେସରେ ଦିସ୍ ଟାଇପ 2 ଡାଇବେଟିସ୍ ଆଉ ଗୋଟେ ପ୍ରକାର ଅଛି ଦିସ୍ ଇଜ କଲ୍ଡ ଜେଷ୍ଟେସନାଲ ଡାଇବେଟିସ୍ ମେଲାଇଟସ୍ ଯୋଉଟା କି ପ୍ରେଗନେଣ୍ଟ ମହିଳା ମାନଙ୍କୁ ହେଇଥାଏ ସୋ ଆପଣ ଟାଇପ୍ସ ଅଫ ଡାଇବେଟିସ୍ ଲେଖି ରଖନ୍ତୁ ଜଷ୍ଟ ରାଇଟ୍ ଦ ଟାଇପ ଅଫ ଡାଇବେଟିସ୍ ଓକେ just write the types of diabetes type 1 diabetes type 2 diabetes and gestational diabetes okay just type why I'm telling these things कि ଆପଣ ନିଜର କୋଉ ଟାଇପ ଅଫ ଡାଇବେଟିସ୍ ଆପଣ ବି ଜାଣିପାରିବେ ତାର ଏକ୍ସାମ୍ପଲ ଦଉଛି ଆପଣଙ୍କୁ ଯଦି ଟାଇପ 1 ଡାଇବେଟିସ୍ ହେଇଥିବ ଛୋଟ ପିଲାମାନଙ୍କୁ ହେଇଥାଏ ଯୋଉଥିରେ ଆପଣଙ୍କ ଇନସୁଲିନ ପ୍ରଡକ୍ସନ କମିଯାଏ ଓକେ ଯୋଉଟା ଟାଇପ 2 ଡାଇବେଟିସ୍ ଆପଣ ସେଥିରେ ଦେଖିବେ ଇନସୁଲିନ ସେନ୍ସିଟିଭିଟି କମିଯିବ ଆପଣଙ୍କର ମାନେ କଣ ଇନସୁଲିନ ଥିବ କିନ୍ତୁ କାମ କରୁନଥିବ ବୁଝିପାରିଲେ ସପୋଜ ମୁଁ ଏବେ ଯୋଉ ଆପଣଙ୍କୁ ଏକ୍ସାମ୍ପଲ ଦେଖେଇଲି ସପୋଜ ଯଦି ଗୋଟେ ଟାଇପ 1 କେସରେ ସି ପେପ୍ଟାଇଡ ପୁରା କମିଯାଏ ହାଉ ଟୁ ଡିଫରେନ୍ସିଏଟ ଟାଇପ 1 ଆଣ୍ଡ ଟାଇପ 2 ଟାଇପ 1 ଡାଇବେଟିସ୍ ଆପଣ ଦେଖନ୍ତୁ ଛୋଟ ପିଲାମାନଙ୍କୁ ହେଇଥାଏ ଛୋଟ ପିଲାମାନଙ୍କୁ ବଟ୍ ଟାଇପ 2 ଡାଇବେଟିସ୍ ବଡ ଲୋକମାନଙ୍କୁ ହେଇଥାଏ ପ୍ରାୟ ଓକେ ଛୋଟ ପିଲାମାନେ ଯୋଉମାନେ ଆଇସ୍କ୍ରିମ୍ସ କୋଲ୍ଡ ଡ୍ରିଙ୍କ୍ସ ଆଣ୍ଡ ଅଲ୍ ଦିସ୍ ଥିଙ୍ଗ ବେଶୀ ଖାଉଥାନ୍ତି ଛୋଟ ପିଲାମାନେ ଦ ଜଙ୍କ ଫୁଡ ଆଇସ୍କ୍ରିମ୍ସ କୋଲ୍ଡ ଡ୍ରିଙ୍କ୍ସ କୁରକୁରେ ଆଣ୍ଡ ଅଲ୍ ଦିସ୍ ଥିଙ୍ଗ ଜଙ୍କ ଫୁଡ ଯୋଉମାନେ ବେଶୀ ଖାଆନ୍ତି ସମଟାଇମ୍ସ ଭାଇରାଲ ଇନଫେକ୍ସନ ହେଇଯାଏ ତାଙ୍କର ଅଟୋ ଇମ୍ୟୁନ ଡିଜିଜ ହେଇଯାଏ ଆଣ୍ଡ ସେଥିରେ କଣ ହୁଏ ଆପଣ ବିଲିଭ କରିବେ ମୁଁ ଯାହା ବି ଟାଇପ 1 ଏବେ କେସ୍ ଦେଖୁଛି ତାଙ୍କର ଯେତେବେଳେ ହିଷ୍ଟ୍ରି ନଉଛି ତାଙ୍କର ବାପା ମା ପିଲାକୁ ନେଇକି ଆସୁଛନ୍ତି ମୁଁ ପଚାରିଲେ ସେମାନେ କହୁଛନ୍ତି ପିଲା ଜଷ୍ଟ ଡାଇବେଟିସ୍ ହେବା ଆଗରୁ କଣ ଖାଉଥିଲା they are all giving typical history milk products ଖାଉଥିଲା ବହୁତ ଚକୋଲେଟ ଖାଉଥିଲା ବହୁତ ଆଇସ୍କ୍ରିମ ଖାଉଥିଲା କୋଲ୍ଡ ଡ୍ରିଙ୍କ୍ସ ପିଉଥିଲା and this କୁରକୁରି ମୁରକୁରି all this sugary food ଖାଉଥିଲା ଏବଂ ଯେତେବେଳେ ଆମେ ତାଙ୍କର ଟେଷ୍ଟିଂ କରୁ ସେ ପଚାରିଲା ପରେ ବି ସି ପେପ୍ଟାଇଡ ଲେଭେଲ less than 0.01 this is called type 1 diabetes ମନେ ରଖନ୍ତୁ ଯଦି ସି ପେପ୍ଟାଇଡ ଗୋଟେ ଟେଷ୍ଟିଂ କରୁ ଆମେ ଆମର ପ୍ରୋଫାଇଲ ଟେଷ୍ଟିଂ ରେ ପଳେଇ ଆସିବ ସେଟା ସି ପେପ୍ଟାଇଡ ଟେଷ୍ଟିଂ ୟା ଇନ ଦିସ୍ କେସ୍ ଗୋଟେ କେସ୍ ଏକ୍ସାମ୍ପଲ ମୁଁ ଆପଣଙ୍କୁ ଦେଖଉଛି ଯୋଉଥିରେ ଆପଣ ଦେଖିବେ ସି ପେପ୍ଟାଇଡ ଗୋଟେ ଟେଷ୍ଟ ଲେଖି ରଖନ୍ତୁ one test to differentiate type 1 type 2 this is called C peptide test and this HOMA IR test okay so in this case ମୁଁ ଯୋଉଟା ଆପଣଙ୍କୁ ଦେଖଉଛି this is a HOMA IR report ଆପଣ ଦେଖନ୍ତୁ ଇନସୁଲିନ ସେନ୍ସିଟିଭିଟି 43% ମାନେ କଣ ରେଜିଷ୍ଟାନ୍ସ around 56% so it is called type 2 diabetes okay but beta cell function ଅଛି 82% ମାନେ କଣ କାମ କରୁଛି ବିଟା ସେଲ୍ ବି ବଟ୍ fully function କରିପାରୁନି so it is called typical type 2 diabetes okay but in this case କଣ ହେଇଥାନ୍ତା ଯଦି type 1 diabetes ହେଇଥାନ୍ତା ତା କେସରେ ବିଟା ସେଲ୍ ଫଙ୍କସନ୍ସ ଟା zero hitanda 0%, 0%, yes. But sensitivity 100% upare hitanda in case of type 1 diabetes. ଆଉ ଗୋଟେ ପ୍ରକାର diabetes sometimes called double diabetes. Okay, ଯୋଉ type 1 diabetes patient ମାନେ insulin ନଉଥାନ୍ତି ବହୁତ ଦିନ ଧରିକି ତାକୁ double diabetes ହେଇଥାଏ. Type 1 plus type 2 both. That's called double diabetes. I have seen that. Okay. Okay. And this is the C peptide serum. You can see the C peptide report where I do this test. Because C peptide ଯଦି 4 ଅଛି, that means it is type 2. It assess the pancreatic beta cell function. ଆପଣଙ୍କ pancreas ର beta cell କେତେ percent କାମ କରୁଛି ସେଟା ସେ ଦେଖେଇଥାଏ. It distinguishes between type 1 and type 2. Okay. Sasikant Panda, you please stop the screen sharing. Okay. You please stop this thing. Okay. Yeah. Chalo. So this kind of things happen. So you can see these are type 1, type 2 differentiating feature ମୁଁ ଆପଣଙ୍କୁ ଦେଖେଇଲି. But remember, my friends, all maximum cases, these are type 2 diabetes. Facts. I am just showing you facts. In type 2 diabetes, 90 to 95% people, those who have overweight, insulin sensitivity is less than 50%. Okay. And type 1 diabetes ଛୋଟ ପିଲାମାନଙ୍କୁ ହେଇଥାଏ ଯୋଉମାନେ ଇନ୍ସୁଲିନ ନଉଥାନ୍ତି and but type 2 diabetes ରେ common symptoms ଦେଖିବେ ଆପଣ ମୋଟାପା ଥିବ ପେଟ ବାହାରିଥିବ ପେଟ ବାହାରିକି ବାରମ୍ବାର ପରିସ୍ରା ହଉଥିବ ବାରମ୍ବାର ଭୋକ ହଉଥିବ ଆପଣଙ୍କର this kind of symptom numbness unexplained weight loss ବେଳେବେଳେ ହେଇଯାଏ slow healing of the wounds constant hunger all these are the symptoms. Okay, these are the symptoms of typical type 2 diabetes, my friends. Okay. Sometimes other types is called LADA, latent adult onset diabetes mellitus. Type 1 diabetes in adult is called LADA. So এই କେସରେ ବି ଯଦି ଦେଖିବେ ଆପଣଙ୍କ C peptide low ଥିବ ଲୋକ ପତଲା ଥାନ୍ତି ବହୁତ ପତଲୁ ମାନେ ବହୁତ ପତଲା ଥାନ୍ତି ସେମାନେ and GAD65 antibody positive ଥାଏ ସେଇ କେସରେ. Another type is called FCPT, जोड़ा कि फाइब्रोकाल्कुलस पैंक्रेटियोपैथी जोड़ा जो माने अल्कोहलिक थांती ସେମାନଙ୍କ କେସରେ ଦେଖା ଦେଇଥାଏ maximum କେସରେ ମଦ ଯୋଉମାନେ ପିଉଥାନ୍ତି and sometimes also to some because of some infections କଣ ହୁଏ କି ଆପଣଙ୍କ pancreas ରେ stone ହେଇଯାଏ just showing the image of that pancreas ରେ stone ହେଇଯାଏ right so that stone creates the problem okay and these are the different risk factors in diabetes ଆପଣମାନଙ୍କୁ just basic ଜିନିଷ ମୁଁ ଦେଖେଇ ଦଉଛି these are the major kind of NCDs NRNCDs and all these things so obesity kuhantu diabetes kuhantu cardiovascular disease kuhantu hypertension strokes 90% of people dying due to this disease now 90% people dying because of this disease now right ଏବଂ ସେଥିପାଇଁ ତାକୁ risk factor ଜାଣିବା ପାଇଁ ଆମେ କଣ କରୁ ଆପଣଙ୍କ କିଛି symptoms କୁ ନେଇଥାଉ ଆପଣଙ୍କର କଣ ପ୍ରୋବ୍ଲେମ୍ସ ହଉଛି ବେସିକ some measurements ନେଇଥାଉ some testing କରିଥାଉ and sometimes also we install some CGM. See, these are some signs of diabetes. Okay, you can also type that. You can also know this thing. Acrocodons. ଭାତୁଡି ଯଦି ଆପଣଙ୍କ ବାହାରିଛି ନା ଏବେଠୁ ସତର୍କ ହେଇଯାଆନ୍ତୁ ଆପଣ just check your nape of the necks. Just check your nape of the necks. ଆପଣ ନିଜେ ଚେକ୍ କରନ୍ତୁ ଯଦି ଏମିତିଆ ସାଇନ୍ ଅଛି ଆପଣଙ୍କର acrocodons ଅଛି ରୋଜାସିଆ ଏକିନି ବାହାରୁଛି ବାରମ୍ବାର ହାତ ତଳେ ବ୍ଲାକିଶ ପ୍ୟାଚେସ୍ ଅଛି ଭାତୁଡି ବାହାରିଛି ଆପଣଙ୍କର and these are the blackish patches in the face so understand friends this is you are going to develop the diabetes very soon okay these are the some signs these are the symptoms of diabetes yes you can also type your symptoms in the chat box ଆପଣଙ୍କ କୋଉ କୋଉ problems ଅଛି ଆପଣ just type in the chat box below I just want to check that ଆପଣଙ୍କ symptoms କଣ କଣ ଅଛି just type in the chat box below I just want to check your symptoms okay friends yeah so these are the signs of insulin resistance friends and that causes problem this is the diagnostic criteria of diabetes okay ମୁଁ ଯେମିତି କହିଲି ଆପଣଙ୍କୁ HbA1c ଯଦି 6.5 above ଥିବ it is called diabetes fasting blood sugar ଯଦି more than 126 ରହିବ this is called diabetes Plasma glucose after 2 hour ppbs is more than 200. It's called diabetes. Yes. Whole year pimples on skin. Yes. This is a typical sign of insulin resistance. Deepak Samantray Babu. Yeah. So many people, this kind of signs, symptoms, you should aware of all these things. Okay, you should aware of all these things. That's why we do this kind of testing, my friends. Yeah. That's why we do this kind of testing to know your current status of diabetes. ଆପଣ ଲୋକ ମିଷ୍ଟେକ୍ କଣ କରନ୍ତି only fasting sugar କିମ୍ବା PPBS sugar testing କରିବେ and they are not doing any testing and they are continuing their medicine 1, 2, 3, 4, 5 like that and that causes problem. Okay, so ଆମର programs ରେ ଆମେ କଣ କରୁ ବେସିକ ପ୍ରୋଫାଇଲ ଟେଷ୍ଟିଂ କରୁ ଯୋଉଥିରେ କି ଆପଣଙ୍କର କମ୍ପ୍ଲିକେସନ ଜଣା ପଡିଯିବ କଣ ପାଇଁ ଡାଇବେଟିସ୍ ହେଇଛି ଏବଂ ଆପଣଙ୍କର କିଛି କମ୍ପ୍ଲିକେସନ ହେଲାଣି କି ତାପରେ ଆମେ ଆପଣଙ୍କର ବେସିକ ଆଡଭାନ୍ସ କୁ ଯାଇଥାଉ ଆମ ପ୍ରୋଗ୍ରାମସ ରେ ଠିକ ଅଛି ବିକଜ this HbA1c is a very gold standard test 3 monthly ଯୋଉଟା କରାଯାଏ and you can see our results so many patients those who reverse they have a very normal yeah. Some doctors diagnose as follicular. What is the cause of follicular? It's because of sugar, right? It's because of sugary food. Okay? Because diabetes is so many complications. Folliculitis is one of the complications of diabetes. Okay? Because when sugar level is high, that causes infection, that causes inflammation, that causes bacteria to grow in your body. Yes, that causes bacteria to grow in your body. Okay? And that causes folliculitis and infection. Okay. And this is one of the main tests, like fasting insulin level. Fasting insulin level. Anybody have done this test, you can check that. Ideal, it should be less than 4. But nobody are doing this test. Normal less than 6. Okay. Borderline 6 to 10. Can just take a screenshot of this thing also, my friend. Because people are missing this golden test. That's why they cannot know their cause. Okay. Fasting insulin is the single most important predictor of development of type 2 diabetes. Okay. So how to measure insulin resistance? Good test. It is difficult to homa ame karita joda apanku dekhotuli. And insulin resistance is the main cause of all these things. ଏବେ ଯୋଉ ରିପୋର୍ଟ ଆପଣଙ୍କୁ ମୁଁ ଶୋ କରୁଥିଲି particularly insulin resistance case ଟା ଯୋଉଟା so that will show you how much you are resistance now. In my programs, I show that things to you. Okay, just ଆପଣ ଜାଣିଥାନ୍ତୁ ଯେତେ ଡିପ୍ କୁ ଯାଉଛନ୍ତି ଆପଣ ବେସିକ ଜିନିଷ ଶିଖିବେ ଦେନ୍ ଆପଣ ରିଭର୍ସାଲ ଟା ଆପଣଙ୍କ ପାଇଁ ଇଜି ହେଇପାରିବ ରାଇଟ୍ ହୋମା ଆଇଆର ଟେଷ୍ଟ ଯଦି ଦେଖିବେ ମୋର ଦେନ୍ 2 ଯଦି ଅଛି ଇଟ୍ସ କଲ୍ ରେଜିଷ୍ଟାଣ୍ଟ କେସ୍ ଓକେ ସେଇ କେସରେ ଆପଣ ଦେଖିବେ ଟିପିକାଲ ସାଇନ୍ ସିମ୍ପଟମ୍ ମୁଁ ଯୋଉଟା କହିଲି ଆପଣଙ୍କୁ because this high amount of insulin causes all this disease stroke, heart disease, gout, atherosclerosis, and all these things, my friends. So that's why in my programs I do that test also. So I hope ki ଆପଣ ମାନେ basic ଜିନିଷ ବୁଝିଗଲେ. So always don't think ki medicine is best for me because medicine sometimes has side effect. One of my mentor told, uh, yeah, pills thrill but could kill you also. Don't take a pill unnecessarily. Unnecessary pills ନେଇକି ଆପଣ life को बर्बाद करंतनी. What doctors don't get to study in medical school, you know. I am also writing one book now. What doctors don't know about diabetes reversal in medical school. Okay, my book will publish very soon. Okay, and today's final word is that ki, yeah, your knowledge is your power, your best security, and gain it to beat the diabetes forever. ମନେ ରଖନ୍ତୁ ଆପଣଙ୍କ जब तक knowledge ଟିକେ ହବନି ନା ଆପଣଙ୍କୁ କେହି ଡାଇବେଟିସ ରକ୍ଷା କରିପାରିବେନି ବୁଝିହେଲା ସେଥିପାଇଁ ଡାଇବେଟିସରେ ଗୋଟେ ଜିନିଷ ଦ୍ୟାଟ୍ ଇଜ କଲ୍ଡ ନଲେଜ ହିଁ ଆପଣଙ୍କୁ ଡାଇବେଟିସରୁ ପ୍ରୋଟେକ୍ଟ କରିପାରିବ ଏବଂ ମୁଁ ସବୁବେଳେ ଡାଇବେଟିସକୁ ରାଇଟ୍ ଏଜୁକେସନ ପ୍ରିଭେଣ୍ଟ ଡାଇବେଟିସ କମ୍ପ୍ଲିକେସନ ଲେଖିକି ରଖନ୍ତୁ ରାଇଟ୍ ଏଜୁକେସନ କ୍ୟାନ୍ ପ୍ରିଭେଣ୍ଟ ୟୋର ଡାଇବେଟିସ କମ୍ପ୍ଲିକେସନ ବଟ୍ no people are interested on this thing right friend so this is the basic tags of today basic task in the sense ki first task is yeah, save this number. My number is this much, and just WhatsApp me your name, age, weight, problems, and any reports to my number. This is the day one task to you all of friends. Okay, this is the day one task. Save my number first. Yes. And please do it right now. ଏବେ ଆପଣ କରିଦିଅନ୍ତୁ, କାମ ପଟିଯିବ। ଆପଣ ଲାଇନରେ ଅଛନ୍ତି, ଏବେ କରିଦିଅନ୍ତୁ। ଆଜିର ଟାସ୍କ ପଟିଯିବ। ଯେଉଁମାନେ ଦେଖିନଥିବେ ସେମାନେ ପୁଣି ଆଉ ଥରେ କରିବେ। ମୋ ନମ୍ବରକୁ ଆପଣ ସେଭ୍ କରିଦିଅନ୍ତୁ। ଆପଣଙ୍କର ନେମ୍, ଏଜ୍, ୱେଟ୍, ପ୍ରୋବ୍ଲେମ୍ସ ଆଣ୍ଡ ଅଲ୍ ଦିସ୍ ଥିଙ୍ଗ ଆପଣ ମୋତେ ହ୍ୱାଟ୍ସଆପ୍ କରିଦିଅନ୍ତୁ। କାରଣ ଆପଣଙ୍କ ରିଭର୍ସାଲ ଷ୍ଟାଟସ୍ ଜାଣିବା ପାଇଁ ଏତିକି ଜିନିଷ ମୋତେ ନିହାତି ଜରୁରୀ। ତାପରେ ପ୍ରୋଫାଇଲ ଟେଷ୍ଟିଂ ବିଷୟରେ ମୁଁ କହିବି ଆପଣଙ୍କୁ। ଯୋଉ ପ୍ରୋଫାଇଲ ଟେଷ୍ଟିଂର ଯୋଉ ଜିନିଷ ଦେଇଛି ମୁଁ ଆପଣଙ୍କୁ, ବିକଜ ପ୍ରୋଫାଇଲ ଟେଷ୍ଟିଂଟା ଏଥିପାଇଁ ମୋତେ ହେଲ୍ପଫୁଲ କରିଥାଏ କି ମୁଁ ଭିତରିଆ ଜିନିଷ ଜାଣିପାରେ ସେଥିରେ ଆଉ କଣ ପ୍ରୋବ୍ଲେମ୍ସ ଅଛି, ଆଉ କିଛି କମ୍ପ୍ଲିକେସନ ଅଛି କି, everything I able to know from that thing also. Okay, friends? Yeah. So please say that. Those who done this thing, just done in the chat box. Just type done. ଯେଉଁମାନେ ମୋତେ ହ୍ୱାଟ୍ସଆପ୍ କରିଦେଲେ ଏତିକି ଜିନିଷ, ଜଷ୍ଟ ଟାଇପ୍ ଡନ୍ ଇନ୍ ଦ ଚାଟ୍ ବକ୍ସ। ଏବଂ ଯେଉଁମାନେ ରେକର୍ଡିଂସ ବି ଦେଖୁଥିବେ ଭିଡ଼ିଓର ଆଣ୍ଡ ସେମାନେ ବି ଚାହିଁବେ କରିବା ପାଇଁ, ଦେନ୍ ଦେ କ୍ୟାନ୍ ଅଲସୋ ଡୁ ଦ୍ୟାଟ୍। ଓକେ। ଆଣ୍ଡ ସେକେଣ୍ଡ ଟାସ୍କ ମୁଁ ଆପଣଙ୍କୁ ଦଉଛି ଫ୍ରେଣ୍ଡସ୍। those who posted the task to my number, just type posted in the chat box. Okay, just type posted in the chat box. Okay, these are tags of day one. Okay, just to know your reversal status, just post these things to me. Okay, yes, because I'm just posting this task in the group also. The day one task for all of you. Okay, I have posted in that group also. Gala. Then second, what kind of test to done? Okay, second task is the profile testing things, right? Yeah, profile testing. If you want that, I also, if you do this testing profile, ଯୋଉଟା ମୁଁ କହୁଥିଲି ଆପଣଙ୍କୁ, ଆପଣ ଯଦି ପାରୁଛନ୍ତି do that profile test is a very important things to understand basic thing. This is the basic profile test ଯୋଉଟା ଆପଣ କରିପାରିବେ, and this is also sharing the number in for outside Odisha, this number. Okay. I'm sharing in the 3 days group. Okay. Another thing जोड़ा ମୁଁ ଆପଣଙ୍କୁ share କରିବି କହୁଥିଲି କି that number. Okay, that number of sharing. Okay, just a minute. ଯେଉଁମାନେ ଭୁବନେଶ୍ୱର ପାଖାପାଖି ଏରିଆରେ ରହୁଛନ୍ତି, for testing they can save this number for testing. Okay. Yes. ଭୁବନେଶ୍ୱର ପାଖାପାଖି ଏରିଆରେ ଯେଉଁମାନେ ରହୁଛନ୍ତି, they can do the testing also. And I also share that things to you also. Okay. Testing number ମୁଁ ଆପଣଙ୍କୁ add କରିଦଉଛି। Call to testing number. Okay. Testing number is 7894406 ଆପଣ ଟେଷ୍ଟିଂ କରିଦେବେ, ଦେନ୍ ଆପଣଙ୍କ ପ୍ରୋଫାଇଲ ରେଡି ହେଇଯିବ। ଆକର୍ଡିଂ ଟୁ ଦ ପ୍ରୋଫାଇଲ ଆମେ କଣ କରୁ, ଆପଣଙ୍କ ଡାଏଟକୁ ଡିଜାଇନ କରିଥାଉ ମାଇ ଫ୍ରେଣ୍ଡସ୍। ୟେସ୍, ବିକଜ ପ୍ରୋଫାଇଲରୁ ବହୁତ କିଛି ଜିନିଷ ଜଣା ପଡିଯାଏ, and according to that result will also guide you friends. So this is for day one tax, and in the day two ଆମେ କଣ ଡିସ୍କସ୍ କରିବା, diets in diabetes, root cause of diabetes, then diets को ଆମେ ଯିବା, root cause को ଯିବା। ଏବେ ଆମେ ବେସିକ ଡିସ୍କସ୍ କଲେ ଡାଇବେଟିସ୍ କଣ, କେତେ ପ୍ରକାରର, କଣ ସାଇନ୍ ସିମ୍ପଟମ୍ସ, କଣ ଟେଷ୍ଟିଂ କରିବା କଥା। ଫାର୍ଷ୍ଟ ଡେ ଗଲା। ଫାର୍ଷ୍ଟ ଡେ ପରେ ଆମେ ସେକେଣ୍ଡ ଡେରେ ଡିସ୍କସ୍ କରିବା ଆପଣଙ୍କର କୋଉ ରୁଟ୍ କଜ୍ କଣ, what are the protocols of reversal, and diets in diabetes. Okay, so thank you so much, and if you have any questions you can just Bipin Pati, just post in the WhatsApp, not in the chat box of Zoom. Just post in the WhatsApp. This is the day one task I am told you. Just post to my number. Okay, you can just when Second day discussion will be tomorrow 9 p.m. to 10 p.m. Okay. So ଆପଣ ପ୍ରଥମେ ଦେଖିବେ ଭିଡିଓ, କିଛି ଡାଉଟ୍ ହେଲେ ଆପଣ ପଚାରିବେ। Okay. So thank you so much for day one, and please post your task. First thing. Second thing, call to the testing number, book your slot for testing. ଆପଣ ଟେଷ୍ଟିଂ କଲା ପରେ ଆପଣଙ୍କ ପ୍ରୋଫାଇଲ ରିପୋର୍ଟ ରେଡି ହେଇଯିବ। ଦେନ୍ ୟୁର ୱାନ୍ ଟୁ ୱାନ୍ କନସଲଟେସନ। ସେ ଭିତରେ ଆପଣଙ୍କର ଅଲଗା ଅଲଗା ଜିନିଷ ଯାହା ବି ଅଛି, ଯେମିତିକି ଆପଣଙ୍କ ଡାଏଟ୍ସ ଆଣ୍ଡ ଅଲ୍ ଦିସ୍ ଥିଙ୍ଗର ନଲେଜ ଆପଣ ନଉଥିବେ। ତାକୁ ଦେଖିକି ଆମେ କଣ କରୁ, ଆପଣଙ୍କ ମେଡିସିନ୍ସକୁ ଟେପରିଂ କରିବାରେ ଆମକୁ ଇଜି ହଉଥାଏ। Posted. Thank you so much, Sachit Parma ji. Okay, thanks a lot. Okay, other people, please just post to my number and just type posted in the chat box. Okay, this is for day one class. I hope you have gained some knowledge. Okay, some knowledge जोटा कि आपण आगरू पाई नथिले। Yes or no? Okay, thanks a lot, Umesh Babu. Thanks, sir. Okay. Deepak Samantara, thanks, sir. Love you so much. It's a convincing, boosting our mentally. Thanks a lot because ଆପଣଙ୍କୁ ମୁଁ ଏକ୍ଜାମ୍ପଲ ଦେଖେଇଲି ସେଥିପାଇଁ କି କୋଉମାନେ ରିଭର୍ସ କରିପାରିଛନ୍ତି ରିଭର୍ସାଲ ଆକ୍ଚୁଆଲି, ବିକଜ ଆଇ ହାଭ୍ ରିସର୍ଚ୍ଚ a lot of things, my friends. I have researched a lot of things, and so you can see to my cupboards. These are all my books of reversal, and you can see some of my other books from this side also. And these are my yeah, food, the medicines and all lies. My doctor told diabetes code, blood sugar solution. So many other books of reversal are there. But yes, I'm just showing some books to you so that you have some basic knowledge on this thing also. Okay. So that ଆପଣ କଣ ହବ କି ଓଡ଼ିଶାରେ first time we are conducting this kind of programs where thousands of patients coming, they are reversing. And we have also sometimes we conduct camp program. You just go to my YouTube channel also, you can see a lot of video there, right? And in that video, yeah, এটা ଜଣଙ୍କର testing report, so that we can benefit କଣ ମତେ ହୁଏ कि ମୁଁ ସବୁ ଜିନିଷ ଜାଣି ଏପୋ ଲିପୋପ୍ରୋଟିନ୍ ଜାଣିଦେବି, everything I know about your reversal status, what can be done in the next step, right? Chalo. This is for the things, and this is my YouTube channel's link. I am just sharing the link in the chat box, or you can search in the Google box. Google, you can type that. Dr. Madhav, diabetes. Dr. Madhav, diabetes, DIABETE, diabetes reversal. PRS. ଆପଣ ସେତିକି ମାରିଦେଲେ ନା YouTube ପଳେଇ ଆସିବ. So many video you can see in my channels, right? Okay, just showing you the link. Another tax is that you please share these videos to others. Okay, please share this video to others so that people can know this thing. Okay, they have no knowledge on reversal. Okay, this is my channel link. Okay, this is my channel link. You just go to the playlist. You can see all these success stories and see their response. ଆମର camp numbers, everything ଆପଣ ପାଇପାରିବୁ. I also conducted some physical camps also. I also conducted some physical camps. And otherwise, I also conducted this online camps also, online programs also. Because ଯେହେତୁ ଆମ camps ପାଇଁ seat ନଥାଏ, ଆମେ online programs ବି ଆପଣଙ୍କ ପାଇଁ କରିଥାଉ, friends. Okay. So no need to worry so much about that. Those who got for camp have already filled up. So ଆମେ online program ବି କରିଥାଉ ଆପଣଙ୍କ ପାଇଁ, no need to worry for that. Even online ରେ ବି so many people have stopped their insulin and medicines. You can listen to them also because we have a lot. ଆପଣ ଏଟା ନିଜେ ଶୁଣିବେ, ମୁଁ ଖାଲି ଆପଣଙ୍କୁ link ପଠେଇ ଦେଇଛି, and you can listen that. Any other questions from the day one, you can just ask in the chat box. Okay, so I try to clear your questions. Okay, just type your question in the chat box. Day one. Okay, go to the chat box. Just type your questions. Okay, then I'll talk with you all tomorrow. Physically, where you can meet you, sir. Deepak sir. You can meet me physically in my camps also. Now, upcoming camp is 23rd, no, 24th. 24th ରୁ ମତେ ମିଟ୍ କରିପାରିବେ up to 28th in ବ୍ରହ୍ମପୁର। ବ୍ରହ୍ମପୁର ଛତ୍ରପୁର ପାଖରେ, ଛତ୍ରପୁର ପାଖରେ ଅଗସ୍ତି ନୂଆଗାଁ ଆମର କ୍ୟାମ୍ପ ହୁଏ ସେଠି। ସେଠି ଚାହିଁଲେ ମିଟ୍ କରିପାରିବେ। ମୁଁ 24 ତାରିଖରୁ ସେଠି ଥିବି। And if you want to meet me in Burla, now I'm in Burla. And sometimes I am in Bhavanipatna. Sometimes I am in your Bhubaneswar. So different places ଆମର camps, so according to camps I'll change my place also. But ମନେ ରଖନ୍ତୁ କି ଆମର online ରେ you can meet, online is best also for you. Okay, no need to worry. You can, we are all educated, because thanks to the social media now, thanks to the this thing, WhatsApp and so that ଆପଣ ସେତିକି ଦୂରରେ ଥାଇକି ବି ମୁଁ ଆପଣଙ୍କ କ୍ଲାସ ନେଇ ପାରୁଛି, you know, so it's good. ଭୁବନେଶ୍ୱର କ୍ୟାମ୍ପ ଟାଇମରେ ମିଟ୍ କରିବି। ଭୁବନେଶ୍ୱରରେ କଣ କି ଆମର ସିଟ୍ ଅପ୍ ଟୁ ଅକ୍ଟୋବର ଅଲ୍ ସିଟ୍ ଫିଲ୍ ଅପ୍। ୟୁ କ୍ୟାନ୍ ବୁକ୍ ଫର୍ ନଭେମ୍ବର ଆଣ୍ଡ କମ୍। ଓକେ, ଚलो। Next, any questions from participant? No questions. Okay. So thank you so much for day one. And it's time to say goodbye to all of you. But before going that, please post your task. No, no, not in Baleshwar. Okay. Baleshwar ମୁଁ ଯାଉନି। Okay. କେତେଟା ଜାଗା ଯାଇପାରିବି? ସବୁ ଜାଗା ଯାଇ ହବନି ନା। So I go to some limited places, Chalo. Thank you so much. And this is for day one classes. And yes, we'll meet you on day two also, friend. Not a issue. We'll meet in day two. Okay. So thanks a lot. Please post your tasks right